All right, so we get to look at the ventilation function test. All right, ventilation function test. Right. So when you hear ventilation, you know that it's just different types of tests which I use to what access how well you are breathing. Do you understand? You want to use this to access how well you are breathing. So looking at this, for the types of ventilation, that's different types for ventilation. Sorry, different types of ventilation. You have the main pulmonary function test, okay, which is basically you are trying to access for movement of air into the lungs and movement of air outside. Okay. Then we have the ventilatory function test, which is mainly what spirometry. Alright, so this one measures for changes in lung volumes by recording changes in the volume of air exchanged through airway opening. Right. Then you said that in spirometry, the volume of air exhaled from the lungs is what plotted against the time during a forced expiratory maneuver. So I think this is the volume. Alright. This is a plot, this is a graph that could be plotted for what? Spirometry. And this type of spirometry, they call it the platysmography. Right, this one you are locked in a container, but the normal spirometry you just hold it out even outside. Okay, yes, you hold it like this even outside and just do it. So that so after you plot the graph, um the VC, okay, VC, that's is VC is what? The volume of air expelled by a maximum expiration from a position of full inspiration. Okay. So if there's slow exhalation, you see a slow VC. There's maximum exhalation, you see what? A forced expiratory this thing. Right. So in obstructive airway disorders, okay. So that FVC is actually what? Forced vital capacity. And the forced vital capacity is what? Is a maximum amount of air that can be exhaled from the lungs after what? A maximum inhalation. You know, some of the air will be left back. That's a residual volume. So you're trying to look at, even if they will be left back, you're trying to look at what will actually go out of that. So in obstructive airway disorders, air trapping during forced expiration. Okay, air trapping occurs during forced expiration. So the forced vital capacity will be reduced, okay, because there's obstructive airway disorders. So the forced expiratory volume in 1 second is the what? FEV1 is the volume of air expelled in the first second of what? Maximum forced expiration from a position of full inspiration. Okay, so this one too is reducing obstructive airway disorders. Okay, reducing obstructive airway disorders. So we said that for obstructive airway disorders, also reduce force vital capacity, but reduction in what? The FE1 is much more. Right. So if you want to take a ratio, you take the one that the reduction is much more all over the one that is just normal, right? So the ratio that is you'll be dealing with is what? The FE1 all over FVC ratio. Okay, and it will be greater than what? 75% normally in obstructive diseases. Okay, so I think basically that's it for what? The different types of ventilation function tests that we got.